Hey everybody, welcome to my new critique series. So what I'm going to do is I'm going to take a body part each week, and we're going to do a critique on the images for that body part. Kind of go over some things to look for, exactly what needs to be seen on the image for each image that you take, and what to look for as far as quality goes, contrast, things of that nature, and some things to avoid as well. I'm excited to do this. I think this is going to be helpful for everyone who does X-ray or wants to learn about X-ray. Knowing what to see on the image is a big part of that. So let's get started. Today we're going to do a hand series, okay? And we're going to critique that hand and see what we need to see and what needs to be done differently, okay? All right, let's get started. So I want to teach you guys an acronym that we use in X-ray. It's an acronym to help us critique images and make sure that we have what we need to have on our image. The acronym is actually PACEMAN, okay? PACEMAN, PACEMAN, okay? And each letter corresponds with something that we need to see on the image, okay? So P stands for position. Are we doing the right position? Is the right position on the film, right? Whether it be a PA, an AP, or a lateral, or an oblique, or whatever you're trying to shoot is what you need to be able to see on the image. Area, do we have the entire body part on the image? Say we're doing a hand. Can we see the entire hand? That's what we mean by area. C is collimation. Are we collimated to the body part? Are we way under collimated or way over collimated and starting to cut body parts off, which is not what we want to do. E is exposure. Is it properly exposed? Are we using the right mask technique? Is it too dark, too light? Does it have noise? Is it a grainy image? That's what we're evaluating when we look at E. M is marker. Is it properly marked with a right or left marker, or a PA marker, or an upright or supine marker? Okay. And A is aesthetics. Does it look aesthetically pleasing? We want to put the best X-rays out that we can. It not only helps us, it helps the patient, it helps the doctor, it helps the radiologist make a proper diagnosis. So aesthetics is very, very important. So let's get started. Let's look at a hand series. So a hand series, we're going to do a PA, an oblique, and a lateral, right? So let's look at a PA hand. Now, when I say PA hand, it means that the X-ray energy is entering the posterior part of the body and exiting the anterior side of the body. So it's a PA. So our hand is sitting on the image detector, okay? So let's look at this image right here. Positioning. Is it a PA hand? Yeah, it is. You can look at that image and see that it is a PA hand. Okay. Is everything included? Yes, it is. We've got our distal phalanges here. Those are all included, including the thumb. Okay. We're also including the distal radius and ulna down here. All right. We want to include that entire hand, including the phalanges, the metacarpal, and the carpal, and the distal radius ulna. Okay. So yeah, we've got the entire area. So C stands for collimation. Are we collimated correctly? We are collimated very well on this image. Okay, we're pretty tight up here on the medial side, out here on the lateral side. We're collimated pretty tight to the distal phalanges, and we've included the distal radius and ulna. So yeah, it's collimated very, very well. So good job on this image. Exposure. Yeah, it's a good exposure. It's a very contrasty image, meaning there's a lot of black and white. If you look at the hand there, you're able to see the soft tissue right? And you're able to see the bone. And there's a stark difference between the contrast of the soft tissue and the bone. There's sharp lines there. If there's any sort of disruption in the cortical of the bone, we're going to be able to see it. You'll note that this patient has some pretty good arthritis. You'll note that some of his joint spaces are fairly closed, and he's got little ridges that come out around the joint spaces there. And you know, if we had bad contrast, and we didn't have that stark difference between the bone and the soft tissue, we may not be able to see that. You know, which we wouldn't be able to make any diagnosis from that. Also note that the fingers on a PA hand are supposed to be equal distance apart. You look at the space between number 1 or number 2 and number 3, that's a perfect space right there. However, you look at the space between the 3rd digit and the 4th digit, and it's a little bit closer, where between the 4th and the 5th, we're open again. So critique-wise, the distance between the third and fourth digit here needs to be a little more open. It's not the end of the world. I would not redo this image. It's just something to work on going forward. Make sure that those fingers are equal distances apart. Okay. But yeah, exposure wise, yeah, we're great. We're able to see joint spaces very well, and bony cortical and intermedullary spaces. It's a very good image. Marker, is it marked? Yeah, we've got our right marker up here on the lateral side. And I'm going to preach that. You know, when we're doing extremities, our marker needs to be on the lateral side. Let's be uniform about things. You know, our marker, first of all, doesn't need to be in any anatomy, right? It needs to be outside of the anatomy. And number 2, if we can help it, let's be uniform and put it on the lateral side of the image. You know, if we do a right and we've got our right down here by the thumb, I mean, it's still a right hand, but for uniformity, the arm marker needs to be up here on the lateral side of the film. Okay. I know that's kind of nitpicky, but you know, X-ray is all about making that body part look good. And yeah, we can do that for sure. Keep the marker on the lateral side of the body part. Okay. Now aesthetics, does it look good? Does it look pleasing? Yeah, it does. It's a nice looking PA hand for sure. You know, it's hung correctly. The fingers are pointing up like we always want a hand. If we were to take that image and it come out sideways or fingers pointing down, we could just really easily hit the button that rotates that image up and makes it look correct. You know, for us looking at that is a right hand. If I were to stick my hand out in front of me, it would match that image. Okay. All right. And name is the last one. I omitted the names on these just for HIPAA purposes. But yeah, there was a name up here. Make sure your name, patient history, birth date, and medical record number on all of your images. Okay. So a good PA hand. Let's move on to the oblique here. Okay, the oblique's a little different. It's not a great image. Just looking at it, I can tell that is an oblique hand. It's a 45-degree hand, which is what we're doing to get a little bit different angle of the bones, right? So positioning wise, we're a little bit steep in our oblique. Okay. You'll note here that there's a good distance between the 2nd and 3rd finger right here. That's how the entire hand should look. Okay, and if it was properly oblique, that's how it would look. In most of our clinics, we have an oblique sponge. It's a sponge that has the step-offs. And if you put the patient's fingers on that, it's going to put you in a perfect oblique. Okay, so you're going to have equal distance between fingers, right? This one, we didn't use the sponge, and we're a little bit steep on the lateral edge. Okay. Note that the 4th and the 5th finger are superimposed over each other. We can help it on the oblique. We need to try and not let that happen. Okay. So, oh, sorry about that, guys. And I hit the wrong button. There we go. All right. So, and you'll note the distance between the third and fourth is a little bit tighter than that of the second and third. So make sure your fingers are equal distance apart, even on the oblique picture. Okay. We're able to see the distal radius and ulna, which is good. Okay. Exposure wise, it's a good picture. We've got good contrast. We're able to see that difference between the soft tissue and the bone, right? Got good sharp edges. We're able to detect lots of stuff. If there was any disruption in the cortici, we'd be able to see it. Okay. Marker, yep, marker's there, and it's on the lateral side, which is a great job. Very, very nice. And I know that the name is there because I cut it off. Anyway, as far as oblique hands go, you know, aesthetically pleasing, yeah, I mean, it looks good, but it's a little bit over rotated. Just make sure when we rotate our obliques that we've got equal distance between the fingers right there. Okay. All right, let's move on to the lateral hand. Okay, this is what we call a spider lateral, or some people refer to it as a fan lateral. Now, half of this image is good, half of it not so much. Okay. Looking at the positioning part, I can tell that it's a lateral, and a good way to know if your hand is lateral, look at your radius and ulna. The radius and ulna need to be superimposed over each other. Okay, the radius is going to be on top of the ulna. Whenever you think you're x-raying a hand and it looks like it's oblique, but if we feel our wrist, you can tell that I'm a little bit under rotated. So make sure that that radius and ulna are on top of each other, even on a hand x-ray, okay, or an elbow x-ray or a wrist x-ray, okay. Make sure that those are superimposed. That'll make sure that your hand is in a good position. The only thing I don't like about this picture as far as positioning goes is our third, fourth, and fifth fingers are superimposed over each other, the distal phalanges, that is. Your metacarpal and your proximal phalanges are going to be superimposed over each other. But your distal phalanges, they need to be spread out. So if you're doing the fan lateral, they need to be spread out so you can see the distal phalanges independent of each other. You can see that the fifth, fourth, and third are kind of all skittywampus. You know, other than that, the rest of the hand's in a pretty good lateral position. The radius and ulna are over top of each other. Not bad. Just make sure if you're going to do the fan lateral, make sure those fingers are spread out. Okay, so you can see between the distal phalanges. And if you need to help that patient do that, feel free. If you need to move their pinky out a little bit and spread their fingers out a little bit, there's nothing wrong with that, as long as you're not hurting the patient. Okay, just make sure you're getting a good look at those distal phalanges. And the metacarpals here are basically superimposed over each other. Yeah, it's a good picture that way. Collimation wise, yeah, we're in good shape. Collimated very well. We're able to see the distal radius and ulna. We're able to see the distal phalanges very well. Okay. Marker, yep, we got a marker on the lateral side. Very good job again. Now aesthetics, yeah, it's a pleasing looking image, other than the distal phalanges are somewhat superimposed over each other. Okay. Just, this is what x-ray is about, is taking a picture, looking at that x-ray and figuring out what you need to do different. If it needs to be retaken, which I would not retake this, at least you know what direction you need to take that to fix the problem with that image. Now, the next time I take this hand, I'm going to pay close attention to spreading the fingers out and seeing those distal phalanges. Okay, it's all about learning. I've been doing this for 22, 23 years, and I'm still learning. When I take an image and it's not quite what I want, I'll make note of that in my head and and take special interest in positioning that body part the next time I take one. Just so I can always try to come out with the perfect image, the perfect diagnostic images, and that's what we're trying to do. And like I said before, I look at a lot of images that people take here, and I like what I see. You guys are making a great effort. You know, there's still some work to do, absolutely, and that has to come from you. You know, I'm doing everything I can to help you, and I would appreciate it if you guys would get on and go through the modules and learn what you need to learn about X-ray in order to get a good final product. And I hope that these critique videos will help you do that, to know what you need to see on every image. We're going to go through them all, which I hope will be helpful for you. And I appreciate you watching this video, taking the 10-15 minutes to sit down and watch, and hopefully you learn something. Now, be aware that I am around, and sometimes I don't answer the phone right away, but I will call you back if you have any questions about positioning or the result you're getting on an image. Please don't hesitate to call me. I appreciate the phone calls, and I appreciate everybody's hard work. And we'll catch you next time. We'll probably do a wrist X-ray. So we'll see you next week. Have a good day. Bye, guys.